Hair is not doing right.
Yeah, me too. I'm not having a good hair day.
Uh-huh. Don't have, I
Okay,
have to
I'm going to
figure out.
hit record and then you're going to start talking and do the introduction.
Well, hello. Welcome to Upstream Intelligence. My name is Victoria DaCosta, and I'm a registered dental hygienist. And we are about to just launch into a topic that's a hot topic, right? Shirley, you want to introduce yourself?
Yeah, so I'm Shirley hygienist. Oh my God, I've just
Shirley the
living in my hygiene mind for the last week. It's just been really a grueling experience this last week. My name is Shirley Gutkowski. You can find me on Facebook pretty easily under a bunch of different terms, including my business Primal Air, where we work with our patients to eliminate things like snoring and get people ready for a tongue tie release and recover from one. And sleep apnea is another big area that we work in. So, there's been a lot of things happening in the realm of clinical dental hygiene this last couple of weeks. And we didn't want to let that drop. And we were just talking, Victoria and I, before we hit record. We're
Yeah,
already an hour in. My mouth is already sore. No, I'm kidding.
yeah.
Um, about alternatives and how you can grow your own personal dental hygiene profession. And I know that we've talked a lot already in the past about dental hygiene schools and the problems with the way that the schools work. One of the main pieces is that dental hygienists have 2 years of prerequisites that they pay for. So they already have a full, 2 years of college before they get into an associate degree program for a clinical dental hygiene license and practice. So technically, they have almost enough, just I think there might be 3 credits short of a baccalaureate degree. And they've paid for a baccalaureate degree and they graduate with an associate's degree only to find the legislators are under the impression that you have a 2 year degree and you don't know anything except how to floss people's teeth and yell about flossing.
You know what?
So,
I would like to interject because
good thing.
the junior colleges, and we're Shirley and I, our discussion prior was talking about defining the profession of dental hygiene. What is it? What does it entail? What are the responsibilities? And what do we do with all the education that we have received as a foundation and a base for our future? How many times I've heard dental hygienists say, "Why did I learn it? I'm not using it." And so what we're talking about today is how the future of dental hygiene is going to change. It's maybe this is a good thing, Shirley, because right now Georgia passed legislation that dental assistants through preceptorship can clean teeth. What does that mean to our profession and our careers? And what is it, how does it affect our future? Well, I will say that having taken the 2 years of prerequisites, I was in competition with over 200 dental potential pre-dental hygiene students in a university setting at Idaho State University. I had to be chosen out of those through my prerequisites that I was a good candidate to be allowed into the dental hygiene program at ISU. So right away, they're taking the cream of the crop. Okay. They're not going to deal around. Now, that's a 4 year university. At a 2 year college, they don't have that mindset. What they have is technician. You're going to clean toilets and you're going to mop the floors and you're going to sweep. That's it. You're only know that's your mentality of the leaders and the trainers and the teachers at the university I attended that I had competition to get in. And sometimes these competitions, I met dental hygienists that had tried 3 or 4 times to get accepted. And finally they did, and they were so excited. Well, what happens to that enthusiasm down the road when they realize that they get into the environment and they're not able to use their information they were taught in the university setting? The very first day of dental hygiene school, to this day, I remember, and I graduated in 1989, and this was 1987, I got accepted into the ISU program, and I traveled from California to Pocatello, Idaho. Thank goodness that program director was from New Jersey, New Jersey, and she was highly motivated to teach us our purpose. And she said the very first day of dental hygiene school, we can train a monkey to clean teeth, but we're going to train you why you are a dental hygienist. This was our program director. And
Mhm.
I never forgot that. Why? And I never forgot that we can train a monkey to clean teeth. So there was in her agenda, in her belief was we are not simply toilet bowl cleaners.
Right.
And and that was the base of my belief when I came out of dental hygiene school. I was excited to use all the information about the oral systemic, and I performed extraoral and intraoral palpations on every single person, every single time. And what I heard was by
No
the
one's
patient,
ever done that to me before.
no one's ever checked. No one's ever checked my arteries. No one's ever checked my neurology. No one's ever checked my glands inside my underneath my tongue. No one's ever checked for, free and pull on the retromolar pads. You're the first. No one's ever looked with any kind of intensity at the tissue colors. And guess what? I was booked up 3 months in advance. I was requested dental hygienist at every dental practice I worked at. And guess what that created, Shirley? Jealousy.
Animosity and
Oh
competition
yeah.
in the dental office.
Oh yeah.
And
And guess
why
what?
how come we have to empty the garbage at the end of the day and she doesn't have to? Well, probably because you were still writing up notes from all of the clinical observations you made over the week, over the day. It's just mind boggling. It's just the whole system is just shocking.
So how do we change it?
That's a big question. And we have to start, I don't know. There are legislative angles to it, which is why the organization, the Dental Hygienist Organization, has spent millions and millions of dollars on lobbyists, which I think is now a huge mistake. The
Mhm.
next thing is to engage the public. We as dental hygienists are just disorganized because most of us are women and most of us have little kids at home and most of us have husbands that also want to be looked at. So it's just the 5 hygienists who are left over, who are old maids or whatever, in charge of everything, right?
Oh,
So we
you're so right.
we need to, I don't know how involved you were. You didn't have any children. I still have a husband. He's also high maintenance and 5 kids. I didn't do anything with organized dental hygiene during that time. Are you kidding me? I had to clean teeth for 40 hours a week. I remember, okay, I'm going to take a tiny sideline and I'm going to get
Sure.
back to that. So, I was working at whatever dental office, and we had a patient that was coming in for clearance before cancer treatment. And I was like, wow, I wonder how this is going to be, because mostly if they see the dentist, they would never see the hygienist under those circumstances. So this was, I don't know, 89, 93, whatever in there. And I thought, wow, I wonder what the doctor's going to do. It was a 10-minute exam and a prescription for fluoride tray, so that the patient would have to wear fluoride against their teeth for a prescribed amount of time during the day to help protect the teeth. And I was like, are you effing kidding me? We spent a whole semester on treating cancer patients, and all you're doing is giving them a fluoride tray, and you're the dentist. So all of those kinds of stories have piled up behind me to make me think to myself, they dentists really, and this is probably the spiciest thing I ever say about this whole thing, although I do get a little spicy, is that dentistry is necessary when dental hygiene fails. And they, the dentists, are in charge of our education. They create our educational certification programs for the schools. They do all of that, and they're the ones who say which classes we should have in order to get a license to to take care of people's mouths. They have a little bit of I don't know, an hour. Do they get like 3 hours on dental hygiene? So then they're looking at us like we're too stupid to learn it in a 3 hour class. And why did you need to take a whole, 2 years? And so we're in a pinch. We're in a patriarchal pinch that doesn't really reflect what our education is and what our motivation is.
How about
So
value? How about value?
that's why we need the
Yeah.
public to understand, because they are in our lap with our hands in their mouth, and they get it when they get somebody like you to clean their teeth or check them over or whatever. We're trying to get rid of the term cleaning teeth, but I don't know what else to replace it with.
Well,
But that's who we need, is the public.
I didn't mind cleaning teeth because I had, while their mouth was open, 40 minutes to chat and they couldn't chat back. So I had a lot of time to educate. But more importantly, what I see is the menu in dentistry hasn't changed. The way they deliver the services hasn't changed. What we talked a little earlier about, you have these businesses still in business from when I was a child. How can that
Yep.
be? McDonald's. Well, if they kept the same menu as they have now, 50 years later, they wouldn't be in business. They've had to evolve the menu as the consumer wants different services and foods provided. So chicken McNuggets. They have breakfast burritos. I mean, all of this dentistry hasn't adapted to patient and consumer demand. Consumer demand will change the dental hygiene profession with added on service. The dentist saw the added on services added on time away from productivity. We see it as business women, we see it as you need your McNuggets in there to attract more company, more business. If you want to be a big business person, you're going to listen to the consumers' demand. That's why they take all these surveys and ask you to rate their products and their services constantly in the email. And I've seen the dental industry and the medical industry take it for granted because they have the degree. Take it for granted because they have the dental insurance or medical insurance. They don't have to offer customer service. They don't have to offer customer or meet customer demand. It's just what it is, and the customer has to just deal with it, and that's that. Well, guess what? Wellness centers are populating the planet right now, and wellness centers are making bank. And I've worked out of those centers, and people will drop almost 30 to $40,000 at these centers and think nothing of it because their demand is they want to invest in their health. And how come surely every wellness center I've worked in doesn't have any dental. So when I came along and started working and talking about the connection of the dental services, guess what they wanted? Well, is there a dentist that I can go to that will look at the saliva and will look at,
Yeah.
and is there someone that works with your team? And guess what I
We
had to
don't have time. We don't have
no,
time.
guess what I had to say to the consumer? No, there isn't
No, there isn't anybody.
one. I am looking for a dentist. So I go to the younger ones that are out of school. They've got the overhead, they got to pay back, and they shake their head and they go, I'd like to, but I can't. I'm strapped. I have to do the drill fill bill to pay my bills. And then you go to the midstream dental hygienist or a dentist. There's the three types of dentists, the drill fill bill, the ones that want to learn and expand, but they're poor businessmen or women and they don't understand how to add these services in the
Right.
time of the day. Then the third type of dentist is the dental physician minded dentist. They're teaching, they're out there collecting income off of what they've learned in research, but put them back in private practice, they're clueless. There's no implementation. They're on the road teaching these dentists that pay thousands of dollars to hear them talk. Guess what? These dentists get excited and they go back to their offices, and then there's no implementation systems. So they get all excited. I want to become a dental physician, but how, when I go back,
What
there's
do I
nothing.
do?
Yeah, how do I do it? How do I, there's no instruction and there's no protocols. So we have a lot of voids in this whole community that we want to um, uh, educate and also help guide through our consulting. You and I, Shirley, hired, we would be able to analyze a office space, take time to analyze where their holes are, where they can add new services, and how to help them in baby steps, not over, so they're comfortable with the little implement stations, even if it means one item in the dental hygiene department, show them the bottom line. If you take time to do this, you will produce this, the benefits and the value of it. This is how you can start now shifting your drill, what kind of practice or what kind of dentist do you want to be? What kind of dental hygienist do you want to be? And that's where we start because I haven't seen yet anybody vetting the types of in these courses. They're just teaching. They're not saying what kind do you want to be? What kind of value do you want to give to your profession to offer these services for the consumer? Because in the long run, Shirley, you and I know who suffers is the consumer. They suffer and
And
they
they
have,
don't even know they're suffering.
well,
I
some of
think they're
them,
getting a handle on it from the medical side because their needs are not being met anywhere. But from the dental side, it's a little bit harder because cavity, no cavity. That's where they're at in their mind. So they think they're getting everything that they want. They don't know that dental practice should be checking their airway and looking to and talk with them about snoring and some of the snoring tools that they have to stop that condition that is not a CPAP machine. They don't know that periodontal infections start in the gut and that we need to work with some kind of a nutrition guidance system so that we can get the flora not only correct in the mouth but also in the gut. They don't know that their periodontal disease may be contributing or maybe a feature of oral breathing, that they're not breathing with their mouth closed. And then that creates a situation that attracts these bacteria that we now find in the brain of Alzheimer's patients.
well,
So
you know,
this is stuff that should be
well,
happening at a dental office. Go
well,
ahead.
what we're talking about is responsibility. What is our responsibility to offer these services to the public?
It's not a
And
service, it's an observation. You're breathing with your mouth open. Close
well,
your mouth. If you can't figure it out, then come back.
those are symptoms. You're right. Those are all symptoms. And this is where I see our profession going, Shirley.
It has to go that way. It is
Well,
going that way, not
that
too
you're
fast.
okay. Yeah, you're talking about observations of symptoms. What I would like to see our profession go into is become the experts of investigation.
Yeah.
Surely count how many mouths you've been in over the years. I counted. I've been in over 40 to 50,000 mouths. 40 to 50, maybe more.
Yeah.
Over the years of my profession. How many doctors have been in the mouths? Medical doctors?
Medical doctors, I don't know, probably
Inside that
one or
oral cavity.
two with a
Yeah.
tongue depressor. Say, next. That was it.
And how many dentists have been looking at the oral cavity with such investigative? No, the dental hygiene profession is the only profession on the planet. Nurses don't look at it. Nutritionists don't look at it. They might calibrate the saliva, but they're not looking like our eyes are trained to look at the oral cavity and investigate it with a oral systemic connection link. And that's what we are experts at. Nobody else is in the healthcare industry. Nobody, no wellness providers, nobody. I've done the math, I've done the research. Dental hygiene is the only profession that has the skill set and the knowledge and the training to take this information, investigation, produce the reports that are so valuable in their lab reports, and using our tools that you and I are talking about and put it to the system of the healthcare industry. That's where I see we're going to shine because I was drilled with those exams, weren't you? And on the
Oh
mic.
yeah, the tests were brutal. It's hard to study for a test when you have five little kids
Yeah.
under 7, you know?
Remember all the science we had to learn.
Oh yeah.
Remember the anatomy. I worked on dead people, cadavers. I had to study off of cadavers. How many dental hygienists study on cadavers? All of us do. Now, the associate degree members might have that in their prerequisite courses because you had to have it. So,
No. So I graduated in 86. In one of my prerequisite courses was anatomy and physiology together, not separated. And they wheeled in a cadaver one day and we all looked at it and we all got grossed out. And then they wheeled it back out. And that was the last time we saw a dead body.
we worked on it the whole semester.
Nope. That's amazing. Yeah.
And
See what I'm talking about?
yeah,
Yeah.
and we took it apart and we studied it. And the thing is, I was in that class with pre-med, pre-dental
Yep.
students and
Yep.
nursing students. So I was in the same course with these, and we all laughed. We said after we all, take our prerequisites that we're all in a tandem with, we won't talk with each other again the rest of our life. What? That's insane because I'm specializing in a dental hygiene profession that does the investigation. So my point being is that we have a definition to utilize. Let's look at our options and our career options and use it as a base. And if these AS degrees don't have it, they got to get back into it and get these courses either online or study it because the dental assistants coming in with these associate degrees or the DAs, the associate degrees, dental hygienists are out of work. That's a given because from what I see their training is they don't have enough fight or knowledge or frustration. They'll just phase in and become a real estate agent or sell toothpaste.
That's where they go, especially since 2020. They got scared out of the office. They got grossed out by the aerosols, which they'd been exposed to the whole time. They're, afraid of, there's just so much fear during that time. So they've retired and they've gone into things like real estate or some other kind of a ironically sales job. So because they don't want to sell dentistry because it's an impure. So we promised ourselves we would just kind of do a short little thing today. I do want to let everybody know, and you, because I don't know if you know this, we are going to be talking next week to Lancette Van Gelder. She is a Nevada dental hygienist, and she was really raising the flag about the Nevada law that they wanted to change to allow dentists to train dental hygienists, and which would effectively put all of dental hygienists out of work. The reason for that was because these hygienists are running around expecting $70 and $80 an hour paychecks and not even understanding what their job is. It's not to just get people to come back to the office. So Lancette Van Gelder, as I was sniffing around, I was like, she attached to the American Dental Hygienists Association? Well, look at me. She is the president-elect of the American Dental Hygienists Association. She's probably going to be sworn in probably the week after we talk with her. I don't know when their meeting is. I don't know. It used to be in June. And so we'll be talking with somebody upstairs in the ADHA, what do you call it, executive branch. And I promised her that I didn't want to talk about ADHA. I wanted to talk about the state of dental hygiene and what made Nevada so ripe for this kind of even discussion where the legislators would even consider something like that. So that's how we're going to be talking more about it to somebody who has their finger on all of clinical dental hygiene, especially the 10% that are members of our national organization. I'm probably also going to want to talk with her, and I bet you are too, about this idea of the difference between associate degree, baccalaureate degree, and then master's degrees, which you need to have in order to teach at a dental hygiene school, and doctorate degrees. So in the recommendations from the American Dental Hygienists Association already is for 30 years now, it's been a request to have a baccalaureate degree as an entry level for dental hygiene. And there it sits. So I don't know what else to say about that. So it's, dental hygienists want to have a baccalaureate degree, at least the people that have membership in ADHA. So there's a big lot to talk about. I also, in the future, will be wondering aloud about when are we going to see dental representation at the National Institute of Health and the CDC and the FDA, all of that kind of stuff. Some of the drugs that we use in dentistry affect the entire system, and most of the drugs that are prescribed for every other condition has a detrimental effect on the mouth, like in a big, big way. So there you go.
We're opening up Pandora's box, and it's about time it's opened.
For sure. All right. So you can find me on Facebook. My name is Shirley Gutkowski, as spelled right there in the little thing about there. You can also follow America's Dental Hygienist. I don't post stuff on there too often, but when I do, it's worthwhile. So you might want to be a follower of that. And then Victoria, I'm so excited about your rebrand for your Dr. Links. How is that going quickly?
Wonderful. And what's interesting about that rebrand is it's very scientifically, technically researched in the minds and in the knowledge of the dental industry out there that understands. And most people understand infrared imaging. And so dental medical thermography, infrared imaging will now be known as DMT, infrared imaging. And this is the direction we're taking for our future and becoming experts in, the expert leading the industry in this technology so that we are relied upon by the medical and the dental profession to offer these DMT reports, DMT IR infrared imaging reports. And we will be trained and certified. And one thing you didn't mention is that Shirley, we're beginning our school so that dental hygienists hearing us can just say, well, where? It's like, don't worry about it. We got you covered. We're going to have a school online and program, and also we'll have on site, and maybe we'll have a dead cadaver there, huh? No, just kidding.
I'm taking a cadaver course in a couple of weeks down in
Hey,
Chicago.
you know what?
So I get my cadaver pieces in there. And this time I'm going to be ready. I'm going to be like, okay, I wanted to know about this and this and this and this and this.
Right. And we have our 3D version in the software.
Right.
That you can locate me at drlinks.com, DRLINXS.com. Locate our podcast under the tab Science. And we're going to have a tab about our school added to Dr. Links. The reason we have the name Dr. Links is we're collaborating and linking like-minded professionals in all categories, medical and dental, dental, medical, because it's time the consumer gets protected and has a quality of life that hasn't been able to be offered. And we are going to be setting the pace for this.
Open wide, everybody, either your mouth or your mind, and help us go upstream to find the root cause of a lot of these problems. And somehow imagination employed leads you to the mouth. See ya.
That was great.
Hold on.